another info vlog on my channel. And as you read from the title of this video, we're going to be talking about COVID vaccines. Pero wait lang, ano bang credentials ko? Well, for those of you who do not know, I am a registered medical technologist. Yes po, kami po yung mga nagsasabi sa inyo for your COVID test. And I am currently a second-year medical student studying to become a doctor in the future. For those of you who still want to read after watching this video, I will link all of the journals and articles that I saw from credible sources down below. So in the Philippines right now, there has been a known decrease in the trust in the safety and efficacy of vaccines ever since the Dengvaxia issue. But that's another topic for another day. So I feel like it is my moral obligation to help our health workers give confidence back to vaccines since we are still in a pandemic. So here is a video addressing all of the frequently asked questions or concerns regarding COVID vaccines. But first, before we discuss all the questions, let's first have a definition of terms para mas maintindihan nyo kung ano nga ba yung mga medical terms na gagamitin ko in this video. So first, we have SARS-CoV-2 and COVID. Ano nga bang pagkakaiba nila? SARS-CoV-2 stands for Severe Acute Respiratory Syndrome, Coronavirus 2. Meaning it's the second one. While COVID stands for coronavirus disease, this is the infection. So SARS-CoV-2, this is the virus. COVID, this is the infection. Next, we have antibodies and antigens. So first, we have antibodies. These are substances that our body creates in order to fight off infection, while antigen is anything that can make our bodies produce antibodies. So, think of antibodies as guard dogs ng palasyo mo or ng bahay mo, ng katawan mo. They will fend off infection. They help fend off viruses, bacteria, parasites. Kasama sila ng white blood cells. They are actually made by white blood cells to help fight off infection. Next, we have EUA. This stands for Emergency Use Authorization. This is usually granted for drugs na hindi pa nakapasa ng phase 4 ng clinical trials pero there is a great need for them. Like our COVID vaccines right now, they are still under the Emergency Use Authorization. Ang alam kong criteria for this is the drug must have a 50% efficacy. Next, we have mRNA. So these are very, very small molecules in our body that tells our cells what protein to produce. So in this case, for the vaccines, they tell our bodies to produce antibodies. So for the first question, how do vaccines work? So technically, all vaccines have the same goal, which is turuan ng katawan mo kung paano labanan ng virus para when the time comes, alam niya. There are actually a lot of types of vaccines that was made for COVID specifically. First, we have the inactivated type, then we have the protein subunit type, then we have the nucleic acid types, and then we have the viral vector types. Medyo wordy guys, pero explain ko sila isa-isa, okay? Just bear with me. Okay, so for the first one, we have the inactivated virus types. Under this type of vaccine, we have the Sinopharm and Sinovac vaccines. So these types of vaccines actually work by using weakened virus particles and injecting them into your body. So ang gagawin ng katawan mo is ma-recognize niya yung virus na yun. So kayang-kaya ng katawan mong labanan and then it will produce antibodies. So itong antibodies na to actually are what protects us from the actual virus pag na-infect na tayo. Next, we have the nucleic acid vaccines. Under this, we have the Pfizer and Moderna vaccines. So this is actually a very new type of vaccine. It uses either RNA or DNA. In this case, it uses the mRNA. Alam mo ba yung mRNA? Sinabi ko yan kanina. As we know, the mRNA teaches our cells how to make proteins. In this case, it gives our cells, so pag na-injectan tayo ng vaccine, it gives our cells a blueprint on how to make the antibodies against SARS-CoV-2. And now our bodies know how to create antibodies against SARS-CoV-2, and now we have protection. Next, we have the protein or subunit vaccines. Under this type of vaccine, we have the Novavax. So this type of vaccine actually uses what we call the spike protein of the coronavirus. So if you've seen an image of the coronavirus, so it actually looks like a ball with thorns or spikes around it. So what they do is they take these spikes, and that is what they use to make the vaccine. Don't worry, these spikes are harmless and they can make your body recognize the virus and make antibodies against it. Another vaccine that uses this mechanism is the hepatitis B vaccine. Lastly, we have the viral vector vaccine. Under this, we have the Astrazeneca and Johnson & Johnson vaccine. So this actually uses a live virus that is not the target. So it uses a weak virus as a vehicle or a carrier and puts the SARS-CoV-2 protein inside the very weak virus. And once pumasok na siya sa body, yes, you are right, malalaman naman ng katawan natin how to make antibodies against SARS-CoV-2. Question number 2. Are the vaccines safe? The simple answer to this question is that in most people, it is deemed safe by the FDA. Remember kanina when I discussed the definition of clinical trial? Nakinig ka nga ba? So for every phase of the trial, phase 1 to phase 4, they actually add more and more people to it. So for example, for phase 2, they only usually test around 300 people. And then for phase 3, they can test upwards of 3,000 people. So the function of the phase 2 of the clinical trials is actually to see if the drug or vaccine is effective. And if it is seen as effective, it can move on to phase 3. For phase 3, this is the phase where they actually look for side effects or adverse effects that they cannot see in smaller groups of the population. Since mas marami yung subjects or patients, mas marami silang pwedeng makitang adverse effects na hindi nila makikita in a smaller group of people. So according to the CDC, one of the more serious adverse effects of the COVID vaccines is actually anaphylaxis. And this only occurs in about 2 to 5 people per million. So ano nga ba ang anaphylaxis? Think of it as a severe allergic reaction. This is actually life-threatening. However, like I said kanina, sobrang liit ng chance, 2 to 5 per million lang. And if ever this happens to you, medical staff are trained to know what to do and how to help you. We must remember that every person's body is different and there are many factors that can lead to different reactions to the same type of vaccine. Some of the more common side effects of the COVID vaccines reported is pain on the injection site. And since the goal of vaccines is to actually prepare our immune system to fight off the virus, we may experience some symptoms like fevers or chills. However, please do not be worried. This actually just means that the vaccine is working, that your immune system is reacting to the vaccine. Hindi po kayo nabigyan ng COVID ng vaccine. Hindi po ganun, okay? Clinical trials usually take a long time, guys. Usually it's just not a year. However, since a lot of people still die from COVID every day, FDA from different countries actually have what we call the emergency use authorization. So as of recording this video, actually, we have 3 vaccines that were approved for emergency use authorization in the Philippines, namely the Pfizer, the Astrazeneca, and the Sinovac vaccines. Question number 3. What does vaccine efficacy mean? So in order for us to understand what the vaccine efficacy means, I will use Pfizer as an example. So the results of the Pfizer vaccine clinical trials stated that they have a 95% efficacy. Ibig sabihin ba nun, 5% ng taong makakakuha ng vaccine magkakaroon ng COVID? No, actually, what the 95% efficacy of the Pfizer vaccine means is that you have a 95% less chance of being infected with COVID than that of the people who were not vaccinated. So magmamat tayo dito, guys. And if you're not interested on how they derive the 95%, you can skip ahead. I will add a timestamp. However, if you're interested, keep on watching. So for the Pfizer vaccine clinical trials, they actually divided the group into two. They used the ones who got the vaccine and the ones who got the placebo or the fake vaccine. So the placebo group actually only thinks that they got the vaccine. However, none of these participants actually know if they did get or did not get the vaccine. Both groups actually had 21,830 participants each. For the placebo group, 162 participants got infected with COVID, while for the ones who were actually vaccinated, only 8 were infected. If you calculated the risk of infection for both populations, you will actually see that for the placebo group, you have a 0.74% chance of having COVID, while for the ones who were vaccinated, they had 0.04% chance of getting COVID or showing its symptoms. Now, to see the efficacy of the vaccine, we actually have to use a formula. First, let's subtract the infection risk of both populations. We have 0.74% minus 0.04%, and we get 0.7%. This means that the vaccine actually reduces our infection rate or chance of getting infected from 0.74% to 0.7%. Ha? 0.7% lang? Apakaliit naman. Wait, sis, chill ka lang. Nag-compute pa tayo. To see the actual efficacy of the vaccine, we must actually scale this very small percentage to the actual risk of infection. So we have 0.7% over 0.74%, and now we have 95%. Yes, thank you, Lord. Tapos na yung math, naubos yung brain cells ko dun. I am not mathematically inclined. I'm so sorry. However, if you understood this, like this video. So now that we actually know how the efficacy of these vaccines were derived, mas maintindihan na natin yung mga published phase 3 clinical trial results. Question number 4. Okay, gets ko na yung efficacy. Anong efficacy rates ng vaccines? So for this part of the video, I'll only be including 3 vaccines that were granted emergency use authorization in the Philippines, namely Pfizer, Astrazeneca, and the Sinovac. Again, if you want to read the journal articles of these vaccines, I will link them down below. And since every other week ata merong mga bagong published articles, since marami na ring data in other countries, I'm so sorry if hindi updated yung iba dito since I researched this for this video actually a few weeks back. And if my new data, you can comment down below. First, we have Pfizer. Kahit wala pa actually talaga sa Pilipinas. When kaya guys, gusto ko rin ng 95%. As I previously said, they have a 95% efficacy rate. And their study actually involved from 16-year-olds to 91 years old. So, pwede siyang actually i-recommend for our senior citizens. So, the journal article that I read actually addressed the 6 deaths that were actually reported before. If you still remember that news, pero feel ko naaalala mo, 2 recipients died, 1 from atherosclerosis and 1 from cardiac arrest, as did 4 placebo recipients, 2 from unknown causes, and 1 from hemorrhagic stroke, and 1 from myocardial infarction or heart attack. No deaths were considered by the investigators to be related to the vaccine or the placebo. So to repeat it, 2 recipients of the vaccine actually died, however, not from the vaccine, but from previous conditions that they had. And 4 who received the placebo, or the ones who got the kunwaring vaccine, actually died of causes that were not related to the ones that na tinurok sa kanila. Next, we have the Astrazeneca. So, the article that was published last December 2020 that I read were actually combined from 4 trials, 2 from the UK, 1 from Brazil, and 1 from South Africa. So the efficacy rates actually differ from the 4 vaccine trials. However, they have a median efficacy of around 70.4% after 2 doses. This is actually still a pretty good number, guys, so don't worry. So they also stated that you will actually already have a 60.4% efficacy even after the first dose lang. So you still have a pretty good protection kahit first dose pa lang nire-receive mo. Their study also included 18-year-olds up to greater than 70-year-olds. So this vaccine can still be recommended for our senior citizens, for our lolos and lolas. It is also nice to note na for these 4 vaccine trials, no one actually got severe COVID, meaning walang na-hospital. So even if they actually showed symptoms or were infected and got COVID, their symptoms weren't actually severe enough to warrant being hospitalized, which is really good. So I found another study for AstraZeneca. However, it is still being peer-reviewed, and it was published last February 3, 2020. So this new study that is still being peer-reviewed actually stated that for the first dose, they actually gave a 74% protection, and after 2 doses, you have an 82.4% protection. So guys, 82.4%, that's actually a really big jump from the 70.4%, and it's a really good number. And lastly, we have Sinovac. This is actually where it gets tricky. So in medicine, guys, before accepting any new research, it must first undergo peer review. What is peer review? This is actually a process where experts from the same field of the research, in this case the COVID vaccine, they actually review the journal or the study conducted and see if it is actually quality, if it is true, if it is valid. Sad to say that I have not seen anywhere a peer-reviewed article regarding the Sinovac vaccines. Meron siyang phase 2 actually na peer-reviewed article, guys. Nakita ko yon. But of our phase 3 clinical trials na the only articles that I was able to find were the ones that were published in their website. So the phase 3 clinical trials for the Sinovac or CoronaVac, they actually stated that after 2 doses, the efficacy rate against diseases caused by COVID-19 was 50.65% for all cases, 83.70% for cases requiring medical treatment, and 100% for hospitalized, severe, and fatal cases. So these are actually 3 numbers that they published. The overall efficacy, yung nakikita palagi sa news, is 50.65%. However, ang maganda dito, guys, is like Astrazeneca and Pfizer, hindi ka ma-hospital. Kasi if ever you get infected or get COVID, hindi severe yung symptoms mo, and it doesn't really require being hospitalized. Technically, lesser mortality or lesser number of deaths. Correct me if I'm wrong or if meron na silang published na peer-reviewed articles. Hopefully, they'll release it kasi mas makaka-boost ng confidence in the Sinovac or CoronaVac vaccine if they actually have the blessing or actually it being peer-reviewed by other experts. So if you have relatives who are still doubting the efficacy and safety of vaccines, please send them this video. And in the near future, if offered, if gusto mong magpa-vaccinate, please get vaccinated. I mean, look at all the diseases na control natin due to vaccines. Look, this is a reminder that vaccines work. Don't forget to like, subscribe, comment down below if you have any questions that I didn't answer in this video. If you have, and if you would actually see me cover other topics. And I'm sorry guys if mabagal ako mag-upload ng videos. Alam niyo na, med student, pero hopefully you've learned something from this info blog. And this is a reminder to you guys that always, always, always fact check everything that you read online that aren't from credible sources. Stay safe everyone. Bye-bye. Subscribe ka.